And we are live. It's convenient that I had back to school on my forehead because this is perfect for this particular town hall. That's why I'm here. Hi, everyone. I hope everyone is doing great tonight. It is Wednesday, September 16th, 7 p.m. or 7:02 p.m. on the East Coast. Welcome to our Anxiety in the Classroom town hall. Back to school. We have some familiar faces. We have some new faces. We have some terrifying faces. We have all the faces. But regardless, before we get started, we like to allow everyone to get in and get situated and comfortable. So take a few minutes, get settled, sign in. Please, 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 as always, say hello. Let us know where you're from. Hi, Deirdre. Hope you're doing well. Should I lower my seat? Perhaps, but then I'm going to be like this on my keyboard. It's going to be weird. Oh, it doesn't go any lower. All right.
Oh, wow. They're coming on.
This really shows off my hairline. Anyway, so, okay. So yes, welcome. Hello, hello. As always, I'd like to encourage everyone to say hello. Ethan is nonstop. Thanks again from Colorado. Hey, Nick, how are you, man? I know yesterday was a busy day for sure. Say hello. Let us know where you're from. We'll get started in just about a minute. Hi, Tim Thomas. Hope
Hi,
you're doing well.
Timmy Tim.
The Tim. Hi, Katrina. Amy Jenks.
Hey, Amy.
How are you?
Hi, Amy.
Hi, Scott. Good evening.
Alejandra.
The room is filling up. Alejandra from Mexico City. How are you? We'll be starting in just about 30 seconds. Welcome to the Back to School Anxiety in the Classroom Town Hall. We're very excited to bring this to you. Lots and lots of content to discuss, lots of important and pertinent information. And above all, we have three amazing individuals to guide us along the way. Hello, Mariel in Ecuador. Snow White is in Portland. I always wondered where Snow White moved to, so that's good to know. There's Jeff Szymanski. Great. Anyway, so we've got a room full of wonderful people. So let's get this started. My name is Ethan. I'm the National Ambassador for the International OCD Foundation, which, as always, simply means I have OCD, and I like to talk about it at this point ad nauseum. We have a lot of content to get to, so I'm just going to jump to the housekeeping portion of this so we can just jump into the good stuff. So this town hall is intended to serve as educational content and is not intended to replace therapy. For treatment-related questions, please be sure to work with your local provider or contact a local clinician. The International OCD Foundation is not a crisis hotline and should not be used if you are in distress or feel unsafe. If you are in a crisis or ever feeling suicidal or unsafe, please go to your local emergency room, call 911, or call the suicide prevention hotline at 800-273-8255. Also, September is National Suicide Prevention Month. There's some great content online, so feel free to Google that as well. As always, we want to encourage everyone to be respectful and kind. We try to create as safe a space as possible, although always keep in mind that this is a public forum. It will live on the internet, so be mindful as you're posting personal questions and comments. But as always, we try to keep as safe and supportive a space as possible. With all of that, I hope you all are doing wonderful this evening. I would love to get to our guests and then jump right into topics. Hi, Amy. Thank you. It is a great panel. We're very excited. So let's start just to I never know if it's my left or my right because everything's backwards in this, but let's start with Dr. Aureen Wagner. Dr. Wagner is an adjunct associate professor of psychiatry at the University of North Carolina, Chapel Hill, director of the Anxiety Wellness Center in Cary, North Carolina, and member of the Scientific and Clinical Advisory Board of the IOCDF. Dr. Wagner specializes in CBT for childhood anxiety and OCD, and is the author of Worried No More, Help and Hope for Anxious Children, Up and Down the Worry Hill, a children's book about obsessive compulsive disorder and its treatment, What to Do When Your Child Has Obsessive Compulsive Disorder, Strategies and Solutions, and Treatments of OCD in Children and Adolescents, a Professional's Kit. So thank you, Dr. Wagner, for being here.
Thank you, Ethan, for the warm welcome as usual. It's been great to do these town halls since, I guess, I don't know, March, April when we started, a few of them. And if it makes you feel any better, Ethan, I'm also somebody that can't tell my right from my left. I still have trouble with it. So I have to raise my head and go like, oh, that's left, and I'm left-handed. So the easy, let me give you a tip. You say that side or that side. That usually works.
That's true. I should have just said to my side, next to me. I should have gone with
next to me, right, and below me.
Next to me. Yes,
Yeah.
would have been good.
Yeah.
Just below Dr. Wagner, we have Denise Egan Stack. Denise is a home and community-based CBT therapist who has been treating children, adolescents, and adults with OCD and anxiety for over 20 years. It's been at least 6 months since I've said that means she started when she was 12, clearly. She has been involved with the International OCD Foundation since 1998 and currently serves on the IOCDF Board of Directors and Scientific and Clinical Advisory Board. She's co-writing the IOCDF website, Anxiety in the Classroom, which is up and live and running, and we are going to talk about it, and helps to plan the pediatric programming at the annual conference. In addition, she has trained professionals nationally and internationally on evidence-based treatments for OCD. Hi, Denise.
Hi. Hi, everybody. Glad to be here.
I like your flowers. They're so bright and happy and fall.
Fall. The weather has changed on the Cape. It's gone from summer to fall, so I have transitioned with it. Pumpkins and summer.
I love the pumpkins. Perfect. And somebody new to the stream that we're very excited to have is Mary Kathleen Norris. Kathleen is a licensed professional counselor in the Fort Worth, Dallas area. For over 30 years, her practice is specialized in the treatment of OCD and OCSD, anxiety disorders, trichotillomania, and compulsive skin picking. She holds a postgraduate certification for behavior therapy, BTTI, from the IOCDF. She has presented on a national level for over 20 years for the International Obsessive Compulsive Foundation, the TLC Foundation for BFRBs, which is Body Focused Repetitive Behaviors, the Anxiety of Association of America, and OCD Texas. She's an adjunct clinical professor at the University of Texas Arlington Graduate School of Nursing. How are you, Kathleen?
I'm good. I'm just excited to be here. And I just want to it's just great to participate in such a heady group of individuals, by the same token, on a topic that I really love. Right.
Well, we're so excited to have you here and get your perspective as well. So thank you all three for being here. As always, I want to encourage everyone to get ready to ask questions. We're going to talk for probably the first 25 minutes, and then we'll get right to questions. So please have your questions ready. Feel free to load in the comment thread. We'll go in order as we get them. So first of all, with this particular group, I really like to do check-ins and see what you're seeing in your own practices and in your own lives. So Dr. Wagner, when we last saw you, we were sort of approaching virtual schooling for the first time. Parents were overwhelmed about how to teach their kids. Kids were overwhelmed about learning online. And we had such great insight and information from you about how to manage. Now we're having back to school, and there's a lot of anxiety around kids and teachers and responsibilities. What are you experiencing in your practice in your life?
Okay, so I'm in North Carolina, and schools around here have already started in mid-August. So whereas some northern states haven't started or won't start till after Labor Day, we've already been going for the past couple of weeks. And yes, I think it's no surprise to anybody, there's just generally a lot of anxiety around with navigating new stuff. Once again, I think when the schools closed in the spring, it was sort of a temporary thing, and then the school year ended. But now there's a sense of like, maybe it's going to be all semester, maybe it's going to be all year. So I think I see anxiety across the board in the children, in the parents, in the teachers. And so what I'm focusing on is helping families and teachers understand that their anxiety is mostly normal. We're all sort of in this boat together, and we're all experiencing anxiety. And the main thing is to ask, is the anxiety reasonable to the context or excessive? Because, when our anxiety is reasonable, then we problem solve. But when our anxiety is excessive, then we aren't able to problem solve. And so I like to share a tool that I think is very simple but very powerful, a feeling thermometer. And you're welcome to download it from my website. It's free and anybody can use it. I give it to parents, teachers, kids. And basically you should size up your feeling temperature when you're approaching school. I ask parents to think about the 3 Ps. Be proactive, positive, and preventive, and thinking ahead. Anticipate what kinds of challenges your child might have with schooling. And then try to approach them in a very positive way. by motivating them with incentives rather than punishments or loss of privileges. And then try to prevent unnecessary kinds of triggers, like, make sure they're getting enough sleep or they're well fed, so that those triggers don't make them more anxious. And being proactive rather than reactive is really key. So the more you think ahead and plan, the better you're going to do. So I've had families say, oh, my child just, when the teacher comes on and she doesn't understand a question, she just freaks out and she comes running to my office and I'm on a business call and say, Mom, I don't understand. What should I do? So that's a situation where the feeling thermometer is really handy because this child's temperature is way above where it needs to be. So I suggest to parents, and I'm also suggesting to teachers actually, that maybe the first 5 minutes before you start teaching or before class starts is everybody sits and looks at their feeling temperature and brings it down to reasonable. And I tell them that, we have a feeling brain that gets all worked up when we're upset. And when it gets up to that 8, 9, 10 range, it shuts down the thinking brain and we can't solve problems. So what's the point of that? So the first thing to do is to bring your feeling temperature down. And if you're a 5 or below, then usually whatever challenges there are, the technology is not working, I don't know where I'm supposed to submit my homework, I don't understand what the teacher's saying, all of those things are solvable if you can stay calm, okay? And then I work with parents and kids to identify sort of 3 areas that they need to be proactive about. What are the academic issues that a child might have? Do they need some accommodations? Are they having trouble with math? What are the social issues? So if a child is isolated, how can you think ahead to create whatever social scenarios are safe today? And then finally, the biggest piece is, again, that emotional piece. So academic, social, and emotional. And so the emotional piece is really important to regulate. When that is calm, the other 2 can fall into place much easier. So that's how I like to approach things.
Thank you, Aureen. I almost feel like the feeling thermometer is almost as important than the regular thermometer right now when people go to school. I think that would be almost more useful. For those of you that are interested in checking out the feeling thermometer, the link has been posted in the comment thread. I don't know if it's sort of time-stamped on your end, but it's at 7:11 p.m. You'll see her the link to check out Dr. Wagner's comment thread. So thank you, Dr. Wagner. Denise.
I recommend that parents and teachers and kids have the thermometer on their desk all the time so that they can kind of calibrate themselves to calm down.
Thank you. I feel like I should have that for work. Denise, fill us in. What are you seeing? What are you experiencing, both in work and personal?
Personal. Well, this is not at all what we are used to, right? And there are just so many questions that people have, like, how is this all going to work? Am I going to get sick? Am I going to get somebody else sick? Can I do this? Can I learn this new technology? Are my students okay? When is this going to end? And that list could go on. And I just think that uncertainty, coupled with the sense of isolation and the deep sense of loss that people are feeling, are really negatively impacting people's mental health in pretty significant ways. And what I'm seeing is that, especially for teachers and some students and some families. In the spring, I was much more worried about families acclimating and, worried about the students and teachers. But in the fall, I'm really worried about the teachers. I think that they're stressed out to the max. And I think we have to pay close attention to that. But so tonight, we're going to try to unpack all of that. I think we're going to try to problem solve some of the issues. We're going to try to get feedback from people at the town hall about, what programming we might develop to help support them in an ongoing way. So that's in general. Clinically, my students, like I said, the teachers I treat and the teachers I know are stressed out to the max. And I hope we can get to some of that tonight and talk about strategies for managing that stress. But students are kind of all over the place. I think my littles are really excited to go back and see their friends. The mask is something different, but they're, a little bit oblivious about what's going on. I think that my socially anxious kids are pretty happy to be remote or halfway remote. I think that it's sort of like an avoidance. The socially anxious kids that were really happy in March about being home that now have to go back, we're really struggling getting them back. I got middle schoolers who, have kind of been out of school since March, and they may not be anxious, but it's just really hard to kind of get them back into learning. The older the kids get, high schoolers and college age kids, I think they're really affected by the sense of isolation. So the kids run on the more depressed side, they're getting more depressed with the isolation. And if the kids I'm treating run on the more anxious side, all of this uncertainty is making them much more anxious. And I think everybody's sort of worried about the future. And then personally, I have a junior at UMass Amherst who's in an apartment with 3 of her friends. And so they're all remote. She doesn't go on a campus. The campus is closed down and she's doing it remote from an apartment. And they're like in a little COVID bubble. And then I have a freshman at University of Michigan who is recovering from COVID. So she got it. And we're sort of dealing with that a third of the way across the country. And then I have a 12-year-old who is all remote from home. He has ADHD and anxiety, and so he's home, and I'm working remote, and he's doing school remote. So I sort of span the gamut here with my experiences.
Thank you, Denise. I appreciate that, and we're looking forward to talking some of that out, and also appreciate the personal insight as well. Kathleen, what are you seeing in your practice and in your life, and what are you observing?
Well, I think that, like, so much of this depends on where you live, right? In our area, very much like Dr. Wagner, we have returned to school, and we have the option of whether to go in person or to, stay online and that kind of thing. So again, we have been back for a few weeks now, right? And so I think really transition is the biggest problem that I'm running into, because I think that's always very difficult with kids in general, but especially with kids with anxiety. 3 main transitions: the online learning from summer, in other words, just going back to school anyway, right? But then what we had in our area is that we went online first and then transitioned to those students who wanted to choose to go back, in person. I think the second one is just being in school in general from 6 months away from it, right? So those that went back to the classroom from about 6 months away, and then somewhat of the fear of others and the COVID. But again, everything that my colleagues mentioned is definitely something that we're all, running into in all the different, and, I think that the points that you made, especially Denise, about the high schoolers and the college, right, is really something that we really need to pay attention to, because it's a real concern. Of course, across the board, the one issue that I'm going to talk about today is just the classroom being away from 6 months. So again, with anxiety, we're going to see separation throughout, right? And I would say that's true with the population as a whole, that like the whole issue of going back to school on a Monday after you've had the weekend at home with family, or going back to school after 2.5 months of being summertime. And, but again, even then you didn't have mom and dad in general at home, the whole group together, isolated from everybody else. And I think that just exacerbates the amount of separation, right? And so one of the big problems that I'm seeing really is the separation from 6 months of being together like that. So again, missing everybody, mom and dad, siblings, pets, etc. The amount of time that we were sharing together during quarantine is not quite the same, right? And we're having more time with, our regular routine, which 6 months in a kid's life is everything, right? I mean, for us, 6 months, but again, for them, it's all that they, especially the little ones, in terms of what they remember. And then just the law of anxiety, the fact that avoidance increases anxiety over time. And the more that you have avoided, then the more that the anxiety, increases. So as an intervention, we've really framed a lot of the going back as exposure therapy, the acquisition of skill, and the issue of distress tolerance, and working with some of the distressing things. On a positive side, really working with self-cheer-up skills and quality time boost in terms of just helping parents with like ideas on how to reward participation and future ideation and things we'll tell each other and do with each other. And, we've had a lot of preferred fun activities, in terms of making lists and that kind of thing, to be able to get through it and go beyond. Right. But that's one of the bigger issues that I'm seeing at the separation.
Thank you, Kathleen. That all makes a lot of sense. I want to address two topics. Obviously, I really want to dive into Denise's topic about teachers and the stress that they're going through, but also I think the kids are important. Aureen, how complicated, and honestly for anyone, but how complicated is the lack of uniformity and continuity within how to approach this across the country? How much is that complicating the situation? Not only are we divided on how to approach in regions in different areas of the country, but literally a school in one county is doing something completely different than a school in another county. So your neighbors and everybody's doing different things. We feel better when in groups we're kind of doing the same thing. Oh, my friends are doing this. How much is that contributing to anxiety, and what's the right thing? What's the wrong thing?
I think a fair amount, and I think complicated is the word. I don't think anyone's found the perfect way to do it. So, I mean, there are schools that are going completely online, some that are doing the hybrid, some that are doing, 2 days in and 2 days out. And some are giving parents choices about these things down here. So lots of parents have struggled with what's the best thing for us. And the way I've, helped them sort of make those decisions is to say, there really isn't a right or wrong answer in an absolute way. Each family has to weigh the costs and the benefits for themselves based on their own risk factors, their own concerns, their own fears. So obviously, some families who might have an elderly family member living there or someone with high risk is going to weigh that more, whereas somebody who's a young, healthy family may not have those concerns. So really, there isn't a good answer that applies across the board. So I think by default, it is that way. It is going to be very different based on so many different kinds of risk factors. So yes, it does create a lot of anxiety because, again, there's no roadmap. There's no roadmap. Our generation has not been through something like this, right? None of us were alive when the Spanish flu came about 100 years ago. So there has not been any world pandemic like this. So everyone is plotting their own path and, through the rocky road, so to speak. But I think I encourage families to just say, okay, what is it that makes most sense for us? There's no right or wrong, perfect fit here, but weigh the costs and the benefits, and whichever way the scales tip, that's what's right for your family.
Identifying family values and also staying flexible because everything changes literally week to week.
Yeah.
Denise, let me ask you a question, which is, and I've heard this not only from my own girlfriend, but other teachers, which is a lot of teachers, especially those that are not virtual, are feeling like they're having to choose between their lives and their jobs. And, the stakes are that high. How do you manage that?
Yeah, I mean, I feel like I just really want to sit with this for 1 second. I mean, we already knew that teaching was an extremely demanding and stressful profession. And so now we add this, and it's even much more so, right? And I think that, different school districts do it differently. But I think that when teachers have tried to voice some of their concerns, I think even in their communities, they may have been met as, with mixed results, So I think that sometimes teachers are feeling like they're not really being fully supported, or their concerns are not being fully heard about how afraid they are, or how hard it is to learn new technology in a very short period of time, or how afraid they are of, going home and getting somebody sick, or what's going to happen if one of their students gets really sick, or someone like one of their peers dies. I mean, they're really sort of fatigued as it is, and now we're sort of adding more to it. And I think that the first thing is really sort of to acknowledge it. But I think the schools, like the leadership of the schools, I think do know that the teachers are maxed out in their stress. But I think that there's been such, there's limited funding. I mean, schools are trying to get proper PPE, let alone having funding for, formal trainings or in-services or supports for these teachers. And so I think that's part of what I want to talk about tonight. I think we all should talk about tonight is like, how can teachers practice good self-care, sort of fight the narrative that we don't have time or that it's selfish, to engage in self-care, and sort of really promote this idea that if teachers take care of themselves in ways that we can talk about in a second, but if teachers take care of themselves, that always trickles down to their students, right? So as educators going back to school, we always focus on the students, but now it's time to put it back onto the educators with the idea that the more that they can take care of themselves, the better off it is for their students. And so, there's all sorts of things that, there's lots of things that are out of control for teachers, but there are some things that they do have influence over, and it's important that they take control where they can. And so one of them would simply be asking for help. Another one might be the self-care with relationship to eating and sleeping and exercise and hobbies and work-life balance. Another one is, if you don't know mindfulness, learning and practicing mindfulness, which doesn't necessarily take away an emotion, but it changes your relationship with stress and anxiety so that it doesn't overtake you, and so that you actually can make choices about how to respond to stress and anxiety. Practicing gratitude. There's lots of different things that teachers can do, and we can unpack them one by one if you want to, but I just think, the stakes feel very high. It's all an experiment. No one really knows what to do. People are, making their best guesses, but the stakes are kind of high. It's their health. And in some cases, they could be getting very sick or even death. So how do they manage that stress? I think, a couple of things that I talked about are ways that teachers can influence what they have influence over while they're trying to manage all of the uncertainty and all of the things that really are out of their control. Does that make sense?
Yeah, absolutely. Kathleen, do you have thoughts?
Yes. I was just struck by thinking about some of the teachers that, that we've been able to, luckily, we've always had patients that were teachers as well as, the students themselves. And I think that one of the real issues, when we think about what they're facing besides all the changes, is just the pressure. What has come to my mind, and again, I am so just surrounded in my own area of knowing what's going on there. And perhaps this is going on nationwide, but what they're feeling is that this last semester, in other words, the spring semester, was a sort of thrown together sort of crisis mess. But now they've had all summer to kind of get it together. And now they need to come across with something that's a lot better package in terms of outcome. And to help the insecurity of parents who otherwise were concerned about the outcomes of the last, the spring semester. Maybe they just felt that kids didn't achieve as much. They didn't really get as much out of the school. And now all of a sudden it's supposed to be an entirely new product. And that's the pressure among many that they're definitely feeling. And when they voice to me, again, not saying that they aren't concerned about COVID or their family members or that, but more than anything, I feel that they're concerned about living up to that and being able to deliver a product that they've never delivered before, right? With some kind of improved version of it without the support of really learning how to do that.
While they're managing their own families.
Exactly.
Sense of loss. Exactly. Their own uncertainty about the future, right? So the burden is on them. It's a story.
And it's just like Aureen said, it's one of those things where in guiding them, when down here, what we had happen in Texas was that they had to go back, but their child might be online at home, right? Yeah. So it was very, very confusing. And one of the other real issues, while we're throwing in all the problems, was that they weren't told. In our area, one of my teachers is so funny because, again, she's a mom of an elementary child. So she's on the blog of the parents, listening to the parents say, here's what's going to happen. And she's like, no. We don't know any of that to be what's going to happen. We have not been told exactly what's going to happen, who's going to be on the computer side of things, who's going to be in the classroom side of things. So again, how do you get that? How do you get your child's at home working on schoolwork? You're there. And they were required to be there in person, even though they were doing the online. So again, it's just things you don't have answers. Yes.
I want to say that even though we're talking about how stressed the teachers are and the very, good reasons why they are so stressed, I do want to say that the teachers that I'm seeing their public face with their to the community and to the students is very positive. And let's make the best of this, and we can do hard things, and we can move forward together. And so, you know, they're managing privately their stress and anxiety while they're really pushing forward to try to have a really great year for their students. And like, that's why teachers are rock stars and they're heroes. I mean, really the heroes, right? But I just think that as we progress and we go through this, we really want to change the narrative that self-care is selfish. It is theirs. We don't have time for it. Really to make sure that we're promoting this culture of the better you take care of yourself, the better you're going to be able to take care of the kids. It all flows down to your students.
Excellent. And to your point, I think that is I mean, again, they, for the most part, love what they do. And that's the grief process of losing the time and experience that they have, the wisdom of what to do and how to help kids, you know, finding in this dilemma, they're able to, like, you know, be able to get through it. I too am just amazed at the attitude. And the interesting part for me was the majority of my patients who were teachers were very excited about returning to school in person. Even in the face, because again, they miss that contact part.
Yeah, I think just like teachers are also parents and have to manage their own children's, you know, learning at home. Parents are also finding themselves needing to be teachers with the virtual learning at home, and that's been difficult for them. But I think one of the things I regularly suggest, because many of them are working from home themselves, is to kind of set up daily check-in points during the day in a proactive, positive, preventive way, so that instead of their child running to them, you know, every minute that they don't understand something, because like you made the point, Kathleen, there's a separation factor now, right? They've been home together for 6 months, very close, depending on each other. And so the child wants to run to their parent, knock on the door. I don't understand what the teacher said. And instead, to set those guidelines up front proactively. Okay, we're going to do our check-in times after the second period and after the fourth period, and it's going to be 10 minutes. And until then, you have to wait. Unless it's a life or death emergency, there's no knocking on my door. So when you set structure and limits like that, I think the parents are finding that, okay, they can manage their work better, the child is doing okay, and it's not allowing the child to seek that dependence and that escape and avoidance rather than handling it themselves. Or teaching children to be assertive, to ask the teacher the question instead of coming running to the parent, right? So I recommend, you know, a check-in time before the school day starts, a couple of points during the school day, and at the end of the day. And the end of the day check-in is, how did things go? What went well today? What was difficult? What's challenging? Let's problem solve it for tomorrow. What can we do differently to make it better? Okay, so again, a very positive problem solving focus is, I think, what helps families.
Absolutely.
I totally agree. And I also want to thank our fourth virtual panelist, Amy Jenks, who's busy. She's been awesome lately. Who's busy posting articles. She also mentioned that Headspace, which is a meditation app online, is offering free access for all K through 12 teachers, school admins, and support staff. So definitely check that out. I'm going to ask a few more questions, but I would encourage everyone to go ahead and ask some questions, because we definitely want to engage you in conversation, your thoughts, your feelings, your concerns, all of those things. So back to teachers for a minute. I know that this is going to be seem obvious in a way, but well, first of all, Aureen and Amy alluded to this. She wrote, fill their cup before they fill their students' cup. So basically the mask first analogy, you put on your mask before you put on their mask, which you're a big proponent of.
Absolutely.
Very much so, yes. Take care of yourself. You know, you have to model calmness for your child too. So, you know, this is a time when everyone's emotional regulation isn't at their best naturally. So parents have to make a conscious effort to regulate their own emotions in order to model for their child and fill up their gas tank before they can, you know, fill their child's.
Absolutely. I also want to thank Michael Ford for the donation. Much appreciated. So my question is, how much, and this is so hard to do because I know, although I'm not a teacher, but many of us have been in jobs where, you know, we're frustrated or annoyed. how important is just to accept the reality of the reality of what's happening and what you have to do, and then being able to work in the confines of that situation, and remaining flexible. I know that there's so many teachers out there that I've talked to that are friends, that say, this is BS. My other friend is virtual. I have to do this stuff every day. And every time I talk to them, I hear this narrative and this conversation, and I want to say, yes, that's true, but that is your reality at this moment. So what can you do about it? How important is changing that mindset? Because otherwise you're just going to continue beating yourself up. Go ahead.
I think it's everything. I mean, I think it comes back to, when you were talking, Denise, I was thinking about how the way that we're trying to frame this is like change your grading scale for yourself. In other words, change the expectations, allow yourself more flexibility, give yourself credit and that self-compassion for like being able to function in this situation and be able to do the best that you can do. And, your ability to get that, the support obviously would be very, very helpful because the affirmation of the contribution. But I think it really has to come from self in terms of knowing, okay, this is very challenging. I'm limited in terms of my resources. I'm limited in terms of my own personal ability to do what I always have. If I measure myself against expectations from the past, I'm going to give myself a terrible grade, which again is, it's just going to come down to the children. So your ability to have that acceptance doesn't mean approval kind of attitude, that very act kind of, what is the value? What is the purpose? What is the pursuit? And can I give myself credit for doing what I can in this moment? Right. And that seems to have been helpful, at least for some of the patients, in terms of redirection, right, how to proceed.
I think this situation has put us into unbelievable exposure to uncertainty and imperfection. So none of us are going to do this flawlessly or perfectly. So I think it makes us kind of feel more humble and accept ourselves as we are. We're just doing our best. And there's going to be lots of mistakes along the way. And there's still lots of uncertainty. We really have no idea how this is all going to turn out from week to week or month to month, or when we're going to be through all of this.
Yeah.
So it's an unbelievable exercise in exposure to reality in the world.
Yeah, I agree. Can I just mention about the acceptance? I feel like we can practice acceptance. Acceptance is a skill that we can choose to engage in, which is not to say that, I'm okay with it or I'm happy with it, but I accept the situation as it is, not as it should be, right? And so it doesn't take away the pain, but it just alleviates the suffering. And so I feel like, when we experience painful things, like we don't want to, we hate it, we want to get rid of it, we want the present moment to be different than what it really is. And I think that weighs people down. And so, if there's one teacher who's accepting, and going to try to do the best she can, is feeling the feelings, but accepting them as just part of her experience in that moment. And then there's another teacher who isn't, and they're under the same, circumstances, the person who isn't is going to be weighed down heavier. I think they're going to have a lower mood, depression, anger, and that's going to really, trickle into their personal life, their relationships, but also the classroom. And so if this really is a values-driven, pursuit, to be of service, to teach your children, you really do want to start to think about ways in which you can accept the situation as it is, not as it should be. Not that you're approving of it, but that you have to carry the emotion differently to be able to be effective in the position that you're choosing to stay in because it's part of your value system.
Exactly.
I love that, Denise. Yeah. I love that. Katie O'Dunn, who was Reverend Katie, who was on our Religious Scrupulosity Volume 2, who's also a teacher, just wrote, for teachers, checkout forms that include feelings can be super helpful for tracking student anxiety over time, especially in hybrid non-traditional models. You can clearly track in your Excel sheet as things shift. This is mine. And she gave an example, a link to her checkout sheet for her children, for her students. We also have a question from Jeff Szymanski, who said, should school systems set up support groups for teachers?
I think it'd be great. I mean, I think the issue is, again, what you made up, Denise, is, I mean, what you mentioned is that if it is just simply, if it's not support oriented in terms of initiatives, ideas, suggestions, and verbs, in other words, action, right? Then we have to be careful. It's the same thing with our support groups. We have to watch that from being, let's all talk about the suffering. And yet there's a point to like the reflection from others and the collaboration of understanding the situation that we're in. But, you know, I mean, again, I think that we could put a lot more into strategies to be supportive, and support groups would be a really good one, right?
Yeah.
Because, you know, and as you said, Dr. Wagner, it's like if people are calmer, then they can, I mean, that's what's so great about humans is they can very creatively think of how can we help? How can we put our thoughts together here and come up with some solutions that can actually.
So I think it's like impossible to expect teaching and learning to occur in a crisis without paying attention to emotions, right? And so again, like there's social emotional learning, and that's made its way into the classrooms, pre-COVID. But now during COVID, I mean, I think it highlights just the importance of it, and it really needs to be sort of systemic, and it needs to be not just for students, but for teachers too. And again, schools have a responsibility of sort of promoting self-care, but also providing some supports for self-care. And I think that one of the ways schools can do that would be through support groups. But I also think that one of my friends who's a principal in a school district or school system in Connecticut said that they've started like buddy groups, like there's support, like there's support teams. And so the teachers know that there's support teams within the school that they can go to access help if they want to. And that is certainly nice and good and better than nothing. But I think we're going to have to try to keep moving forward with this because this isn't going to end soon. And there's so much unpredictability that I think we're going to have to try to find, like Amy's sending links in the chat about, hooking people up with resources. We have to come up with some good resources that people can, can access to as sort of like an adjunctive to what their schools are supplying for them. So
absolutely.
That makes a lot of problem. So Manor had a question. Fran, her 7:42 p.m. question is the short version of it, but I'll read her longer question. My biggest problem rolling with the punches, knowing that 1 week of teaching is going to change next week, etc. I'm going back to my in-classroom teacher job, no training on virtual teaching. I'm a long-term substitute teacher. I cannot let myself accept the truth about not knowing what's going to happen during virtual teaching. And then this is our short-term question. So thoughts? Go ahead, Kathleen or Aureen. Oh my God, you both ended in Aureen. This is so confusing.
Right. Well, I think this is a tough one for all of us, right? Not knowing is something that's just, makes us so frustrated, right? I feel frustrated too. But I think, uncertainty is just a part of life. And I like to repeat that quote by Benjamin Franklin, nothing is certain but death and taxes. And that's on a non-COVID time, right? But now I think just uncertainty is the word of the day. So at some level, we come to a place where we have to make an active choice and acceptance, right? If we keep pushing back against it and saying, I can't accept it. I don't want it. I want to get rid of it. I need to know for sure. Then I think we're just increasing our own distress. So it's a process. This is not a magical thing that happens overnight. But every day I would recommend for you to do that self-talk, to say to yourself, I don't like this uncertainty. I don't like not knowing, but I have to learn to handle it, and I can learn to tolerate it, and I can get through it. So, you don't have to like it. There's no requirement that you have to like the uncertainty. Nobody does. But it's about learning to tolerate and handle and actually finding out you are braver than you think you are.
Exactly.
I say that all the time to my families. We are all braver than we think we are. We tend to underestimate ourselves. But give yourself that credit that you'll get through it.
I think, I think the question said something like, I can't, or I'm not able to, I forget what it was, but it feels like you are unable to. It feels like it isn't a choice, but really there is a choice there. And if you can sit with the discomfort of not knowing and sort of get a workable distance from it. Because a lot of times people have a feeling and it feels like it's like right over your face. You can't sort of see anything past it. But if you can move it over here and get a little bit of a workable distance from it and get some perspective, then you really can be in a position of making different choices, right? So it's not easy to do. And it's not like, oh, after one sentence from Denise Egan Stack, I'm going to learn how to do it. But it's something that you can learn more about, you know, get into therapy for. But it really is a choice if you can get a workable distance from the thoughts. Like I'm thinking that I cannot accept this. I'm thinking that I cannot roll with the punches. There's a you, and then there's a thought. Like a thought is a mental phenomenon. Like there's the thinker, and then there's the thought. And I think if you can sort of get some distance from the thought and get some perspective from it, I think you'll recognize that you do have choices about how to handle things. So, you know, we do not know what's going to happen next week. You're right. And as a teacher, I think that is incredibly difficult. But I think there's little micro choices that you make throughout the day that make it like, I can't do it, versus these micro choices that you might make that will allow you to let go of. Like instead of gripping a steering wheel when you're driving in traffic, sort of like let go a little bit, hold it more lightly. And I think that you'll see that you have a different relationship with the thought.
Absolutely.
I would also the communal part, you know, again, it's not that it offsets all of the suffering or the pain that we are sharing within the community, but actually thinking in terms of all of, you know, my colleague teachers are all in this together. They are facing some similar situations, and then looking towards that courage over the comfort, right? And what that brings us in terms of our own sense of pride when we have overcome the adversity. Surely people have done that through time that we very much admire. And I'm sure that the way they did it was, a lot of it was collective, you know, in terms of just rolling up sleeves and throwing it in together, because I think we need each other for support in those situations. And I think it makes it easier to be more future oriented and think about things that might be different in the future.
Mm-hmm.
Absolutely.
And to take it a step further along those lines, I think the feeling and the thought are one thing, and then there's action, right? That in spite of how we feel, we can still do things. And I think I would suggest that every day you ask yourself, what is my goal for today? It feels terrible not knowing when all this will end. I don't like it, but what do I want to accomplish today? What do I want to get done? And just focus on doing action, things that are important, things that you value, things that are part of your job or your personal life, in your family. And then focus on, I got through it, I did it, and feeling good about having done stuff no matter how you feel. So I think if we focus one day at a time and focus on keeping the feeling temperature down, we put one foot in front of the other and we keep plodding along. We're all in this together.
Mm-hmm.
Absolutely.
It's easier said than done. But when we are feeling very emotional, it gets very confusing, right? It's confusing. What's going on? What am I supposed to do right now? And so the answers that we're giving to you tonight are just, we're trying to help you get some clarity, so that when you are triggered emotionally, when there's a lot of emotions going on and it feels confusing, you'll have these like little clear things to try to help you get through those moments, those little lifelines to help you get through those moments.
Right. The focus on functioning, not on feelings, right? In terms of asking myself, what is my function right this moment? And when I actually achieve that, again, that's a good feeling in terms of that healthy sense of pride that I've actually put forth the behavior that over time is going to change how I think and feel.
Yeah. I just want to note, Katie O'Dunn wrote, her school's motto for the year is, let's get comfortable being uncomfortable. And the Barnstable Public Schools motto is, we can do hard things. So I kind of like when schools are just kind of putting it out there. Like, this is the dilemma. Like, let's get comfortable. Or, we can do hard things. Then it becomes just the way people, it's their way, right? It's their way of handling hard things. So I just wanted to note, I like when schools are doing that.
Oh, that's wonderful. That's putting the cards right on the table and not under the table.
Mm-hmm.
And Katie also wrote, I offer Wednesday morning colleague connections, interfaith prayer for just 15 minutes on Zoom before school. I think just the space for teachers to come together and sharing that with healthy facilitation is so important. So I think also that's a great example of just, taking initiative and not waiting for the school system or the administrators to create something for you. If there's a need, create it, even if it's just a phone call and checking in with another teacher or something.
Which is what teachers do. Teachers been filling in the gaps all along, so.
Right, that's the creativity that's a part of the job.
Yeah.
I wasn't insinuating otherwise.
No. I don't think that teachers often feel that that's how resourceful that they are, but we were just talking about feelings.
Mm-hmm.
They don't always
absolutely
represent the truth.
And simple things like, a Post-it or a sticky on your computer to some of these points that they've mentioned, because you lose in the moment when you're triggered, you lose insight and objectivity. And that's completely natural to just be very, tunnel vision. So to be able to have a visual cue sort of pull you out of that and get like a third person objective point of view is really, really helpful. I also, again, I know you're out there because I'm getting reports on numbers. We are here for you. We are here to answer your questions. So please don't be shy. Feel free to ask questions. I know we're talking a lot about teachers, but if you're a parent, if you have kids, if your children have questions, don't feel like that you're not allowed to ask because we're only talking about teachers right now. Please feel free to ask questions on any topic that's meaningful for you. We are here to discuss them. Also, Amy, which I actually I put the copy away, but Amy brought up, and Jeff brought up acceptance commitment therapy, known as ACT, which is also a very effective treatment, exposure-based treatment. And they brought up Marissa Maz's new book, which is ACT Workbook for OCD, Mindfulness, Obsessive Compulsive, which is very, very good. And so there's lots of other resources. In fact, let's see, I was also looking up, Jeff wrote something else that was helpful, which I am looking for. Yeah. So anyway, we'll get to that, but feel free to.
Can I make one more comment about it's humor, right? Let's not forget too. I think that as a teacher, your children are a constant resource of moments that you just can't. I mean, they're just memorable moments that, like, you can't lose sight of. And so I think that that's a very important part of it too. Is if you can find the humor in terms of trying to pull this off, right? And then kids are just a delight. And it doesn't matter the age, they're always going to be providing those moments, because that's the reason why people do that job, is because it's so reinforcing over time, right? And those little thank yous and those little moments that you're connecting, right? And I think that's, that's a very, very important source of strength. Sorry, go ahead.
No, that was great. I appreciate that. Aureen, talk to me about needs assessment.
Needs assessment. All right. I think you mean the IOCDF is trying to put out a notice to everybody who's involved with schools, parents, teachers, students, to kind of talk about what they're looking for, what they need, what kinds of supports would be helpful to them at this time. So I think, I don't know if they're going to post that link to fill out a survey that will help the IOCDF size up what kinds of, things we might offer as an organization to help support teachers, parents, and students during this time.
So when we education programming, we as a panel can sort of think about what people need, but what we've decided to do is just ask people, like, what do you need? What would you like? Well, how can we help you? And then we start building from that. And I think that we know, all of us here tonight, and you guys, on the town hall, this is a pretty precarious situation. And, we know that teachers need support. We know that students need support and families need support. And we also know that there's not a lot of resources to support it. So we want to be part of the solution, and we want to provide for you what you will need, but we want to hear from you to see what it is you want. And our concern is, like, we're just going to add one more thing to the teacher's plate, right? But honestly, if you can learn some of the skills about how to hold this more lightly or differently, then I think the burden will be lighter. Without really the workload being different, the burden will be lighter because of the way that you're carrying it, and you can carry it differently, learning different skills. And you can learn different skills through an in-service or a training that we provide versus, these little sound bites that we can, give you here in the town hall.
Mm-hmm. And the needs assessment allows you to select whether you're a parent, a teacher, or a student. So it's the same link. And then I think it's like 5-10 minutes. It's not long at all. And also, please feel free to share it with your colleagues and with, if you're a teacher, share it with the parents of your students. If you're a teacher, a counselor, pass it along to colleagues. Send it out as much as possible. We'd love to hear back from as many people as possible.
Yeah. Should we shift to baby kids or families?
Yeah, I was actually just going to ask, are you seeing, well, actually, how are kids dealing with the change in social structure? And that was something that I was concerned about, just hearing what was taking place, what the CDC was recommending. Going to school is very different, than it was. It's very much a social experience for kids, for children, almost more so than the academics and the learning. And so is the mask wearing, I know younger kids not so much, but is the mask wearing, the inability to be close, have to social distance? I know some kids, they're not in cafeterias, they're in small lunch pods, they're not allowed to talk. How are we seeing kids respond to this?
I think most kids are finding it difficult. I think maybe the elementary schoolers, the ones who are going to school, it's not the same. They can't sit together and be in the recess on the playground and stuff. They have to be 6 feet apart wearing masks, right? I'm working with a few college students now, and freshmen especially, I think, are feeling especially robbed of, first of all, their high school graduation year and all those, milestone events and experiences. And now their start of their college experience is not the same. I just talked to a young woman who was going to UNC Chapel Hill as a freshman. She went onto campus, but she said they could barely see each other. They could hardly interact. It was not the usual orientation of a freshman year, all that excitement. And then they had to go back. And she's sobbing as she's talking to me because she feels so isolated. And there's a great deal of feeling of being robbed of the experiences, right? And so there's a grief, there's a loss, milestones that, again, they have to come to terms with eventually. But yes, people are definitely struggling with that. And the ones
wait, Kathleen.
Sorry. The ones
I talked to a number of kids today that were just talking about, and again, they were older, they were high school and college, and they were talking about how pro-social, in other words, how much they need to, they've sort of recognized that if they don't do anything, then they're experiencing a lot of depression, a lot of isolation, but that they're not used to having to put that much effort into, making plans, calling people up. And again, these are things like taking a walk with a couple of kids, or like maybe, going someplace, getting something to eat and going to the picnic. I mean, just again, with all the rules, but they have to be more intentional. And one of them was mentioning, okay, some of the other people are living with other roommates, and so then they're spending time with them. But again, I'm just over here, so I have to be a lot more action oriented. And for someone with anxiety, that's really challenging.
Yeah, I think that for freshmen in college, generally the school does a lot to help them connect socially. Like, RAs are very involved, and they have welcoming events, and then they have these big organization fairs where people can go around and collect information about what clubs or organizations they can get involved in. And I think a lot of freshmen are struggling because, yes, they've lost the prom and graduation, and now they're losing sort of the freshman experience, because if they're kind of introverted or they're kind of anxious, it's really hard for them to just go down the hall and sort of knock on the door and have to stay 6 feet away. In the normal ways to help facilitate social experiences as a freshman just isn't there. And, the ones that are older are thinking about, like, what am I graduating into? Like, what's the world going to be like? I'm worried about my family. I'm worried about my future. And so I think there's, again, like I mentioned in my intro, like the depressed kids who are, more isolated and a little bit more introverted are getting more depressed, and the anxious kids who are worried about getting sick or the future are getting more anxious. But the little ones, I think it's hard. They want to run up and hug their teacher. They want to play around with their friends, and they're having to, like, elbow bump or like wink as a way of communicating, like engaging, or having to learn how to use their words more as a way to socialize. And I think it's just a transition. And again, another thing that teachers have to sort of problem solve and kind of manage and moderate. Yeah. So I think it's a big loss, and it takes there's a lot of adjustment for everybody.
Again, just that, the ability to, so many teachers basically first day, they're online. Here I am, I'm your new teacher, right? Here they are, here are your new classmates, right? And it took the place of what a lot of people were, used to, like activities that we would have before school where you could have sort of a greeting, maybe a little bit of time just with the teacher by herself, to sort of find out more about. And, that's such a good point that like the freshman interest groups and all that kind of stuff. But it's almost, though, on the other hand, my kids actually are recognizing, and they will admit, this is very challenging. Mm-hmm. And there's some determination, I think, with support to like, I'm not going to let this moment go by, right? But again, it takes some more encouragement to say, okay, how can we creatively think? So that's what we did today. We made a number of like strategies. Mm-hmm. We can safely reach out. We even measured, okay, what is the safety of bowling versus skating, right, as a group? And mm-hmm. And these were, trying to think of ways that like, they could continue to stay, but it's really challenging.
Mm-hmm. And I think one of
students are all about problem solving these issues. How can you facilitate social connection in the age of COVID? Taking walks outside or smaller groups gathering outside, but as the weather gets colder, it's going to be harder to do those things. Mm-hmm. How can we do this? Because we're trying to mitigate anxiety and depression, getting worse.
Mm-hmm. So one of the things I've been encouraging families to do is to find like-minded families who share who are calibrated similarly about their risk assessment with the COVID, because, people have such a range of risk assessment.
Absolutely.
And if they can find families who are like-minded in terms of, where they think the safety issues lie, then they create their own social pods. And there are a lot of families who are doing that. I've had clients who say, oh, we have a group of 3 families and we all sort of think alike about this. So we keep each other safe, and we know that our kids can get together because we aren't doing X, Y, and Z, and we can trust that. And so I'm encouraging families to look for other people like that, where they can create their own little social groupings, but they can get together in person because they've got their little isolated pods that are not interacting outside. Absolutely. And that creates a real social experience rather than all this like 3-layered virtual experience that is so complicated.
Absolutely. I love that, Aureen. We have a cluster of questions that actually tee off well one another. Katie asks at 8 p.m., can you discuss the impact of the anxiety from the pandemic, social distancing in the classroom on students with pre-existing mental health struggles? Are these issues exacerbated? Go ahead, Denise.
Yes, they are. I've said it a couple of times already, but I think the kids who run more and the kids who are running more anxious, I think, are feeling more anxiety. My son has ADHD in addition, and I think that remote learning is actually very difficult for him with ADHD. There's, it's like you're sitting in front of a computer, sitting in one spot. It's like you have to click here and then click there and then keep that open and then look over here. So I think even his ADHD, difficulties are exacerbated during all of this. So I think the kids that I'm working with, the ones who are not worse, are the socially anxious kids who actually like being home and like being remote. Exactly. Because for them, it's the social interactions that are very draining and very overwhelming. And so for them, they're kind of liking it. And like I said, in March, those are the ones I'm worried about getting back to school. And so the ones that I do have to get back to school are really, really struggling. And then the ones that can stay home are really liking it. So those are the ones I feel like are not, their symptoms are not exacerbated, but it's mostly because it's avoidance, and we're eventually going to have to deal with this. But for right now, their symptoms are reduced, but those aren't real gains.
Right. I would think anything you have, if you have Crohn's, if you have like, some other like, chronic type of illness, then clearly this whole situation is exacerbating it.
Yeah.
Right. In a lot of ways.
Mhm.
So to follow up, actually, Letty asked a question, which is at 8:02 p.m. What to say to a teacher of a student with anxiety, OCD, 10th grader in therapy for a couple of years prior to COVID. Virus and remote learning has heightened her OCD. Zoom learning is very in your face, no escape when called upon by the teacher. All the peers can see her reaction and insecurities.
Right.
Go ahead, Kathleen.
I don't want to butt in, but I mean, we've had this come up so much that we've developed an ERP protocol, right, in order to help the kids get a lot better at the distress tolerance of being on the camera. And you guys may have seen that too. In other words, a number of people having real anxiety in terms of the focus and being on the camera and that kind of thing. So again, developing ERPs that have them making podcasts and that kind of thing on their own, and getting used to being in front of the camera, and then having the teacher. But again, as many times as I can, I want to draw the teacher in on the situation. If we think that like that's a good communication, and if we think that that's a safe person, that, I mean, not that someone would be unsafe, but again, that they have this understanding of what's going on, is they can actually help us. So we've had this all the way from little ones, just freezing up if they get called on, all the way to like, the older ones. And when the teacher is in on it, they can be helpful to us in terms of gradually turning this up, right? And calling on them for questions they probably know the answer to, and doing some preliminary. We had one teacher that helped us a lot with like, here's some suggested questions I'm going to ask. And like, you can already prompt on some of those. And then like, if you raise your hand, then you have the opportunity. So yeah, definitely. But I've had a number of them to that point that have just melted down in front of everyone.
Yeah. I want to echo, you need to communicate with the teacher, because as the teacher understands what's going on, like Kathleen said, there are things that you can do. You can prompt them, hey, Aureen, you're next. Or here are some quick questions, or, you sort of give a little hand signal so that the student knows they're up next so that they can prepare. But also on a 504 for anxiety and OCD, and I know it's like, how are we delivering services for 504s and IEPs, remotely and in a hybrid fashion? That's a whole nother topic. But you could go to the school and say, like, my child wants screen breaks, or my child, if my child shuts off the camera, it's kind of like when a student needs to leave to take a break to go to the bathroom, or to go get a drink of water, or to work, on, a stress management skill, they can get breaks with the video. So I think it's just important for teachers to communicate with, parents to communicate with teachers about what's going on and make some suggestions about how to manage it. I think that's what we did before COVID. And I think it's what we're going to have to do now. Different things like screens. I mean, I hate being on the screen too. It's not but so screens and signals.
Right. Is pretending a bad connection. Oh, go ahead, Aureen. I
agree with both Kathleen and Denise, and I think there needs to be sort of like a two-pronged approach. There has to be exposure training and distress tolerance, which a therapist might do with the student, but also coordinating with the teacher and telling the teacher and making those accommodations. And I think often what is happening with these kids who are anxious to be virtual is that there's a great deal of anticipatory anxiety, apprehension. They're waiting. They don't know when they'll be called upon. That uncertainty of the unknown moment. When will the teacher call on me, right? They're waiting for the other shoe to drop. So if you coordinate with the teacher and the teacher understands, that uncertainty at least can be removed. And maybe you make a plan with the teacher that you say, okay, I'll call on you in the last 5 minutes of every class. So then at least the student can go like, okay, I can at least listen for all of the class, because I know I'm not going to there won't be a surprise. I always say anxious people don't like surprises, right? Because they're caught off guard and they're flustered and they go into their feeling brain mode. So having a plan for when the student will be called upon, And the student knowing that in advance can really alleviate a lot of that anticipatory anxiety.
Let me ask you a question. Katie brings up something that she's doing in her class, but and this may be a layman question. She wrote, there can absolutely be a change in communication styles with different students. Online using tools like Nearpod and Padlet instead of calling on individual students can be great. You can also have students fill out forms to share their preferred methods of sharing. My question, and Katie works at a private school, my question is, in terms of creativity, do teachers at public schools have the same leeway in being able to implement different styles of teaching in a way that may be more comfortable for students, or do they have to stick to a very, rigid formula?
I think the answer is yes and no. Again, it depends on your setting, the supervision, how much creativity. That's one of the challenges for the teacher. Again, and that's one of the challenges for the parent communicating with the teacher, because there are going to be teachers that I know for myself, when I was teaching, anything you tell me is better than not knowing. So anything that you give me is something that I can run with and use to help all the way around. And when I actually go to an ARD meeting, which is not happening during COVID, right? But again, that's the presentation is like, look, let's make your job easier, right? By helping you know how to help, right? And in a way that's efficient. But I think it's yes and no, because I think that there are settings where you're allowed to use that creativity and you can do all kinds of different things to accommodate. And I think that there are some settings where there is a lot of supervision and there's a lot of like, you got to do it this way. And we can't allow for that. And I actually spoke to a teacher about her concern was that their plan was that the first day of school that they were to go around. This was in elementary school. They were to go around and each person was to tell, okay, what is your hobby? Blah, blah, blah. She felt personally, this is a lot for like day one of like, introducing something. I would have to say with anxiety, that is a lot for like the first day, right? And there was no wiggle room on that, right? So what we were able to do was kind of work with like, give me one word that describes you. Right? Give me a hand gesture that describes you, right? So that you lighten up, but you're still able to follow the rule of like, this is the way we're going to do it. Right. I would hope that almost everybody would have the creativity and the license to do it.
Thank you, Kathleen. Quickly, just Fran is doing a great job of posting some amazing links from Anxiety in the Classroom. So for everyone watching, please scroll through the comments. There's a myriad of links on support and resources and all along. Words are tough today. All along the lines of what we're talking about. Now, Nancy has a question at 8:13 p.m. Are teachers actually accommodating kids with OCD now? We couldn't even get a 504 for our son because he wasn't failing. We got no help from our schools.
Do you mean, is Nancy meaning during COVID or pre-COVID?
Yeah, I would imagine during COVID. Yeah, during COVID right now with.
Well, I wouldn't think that there would be any way that the laws would be any different. In other words, the expectation would still be from a legal point of view, again, not being a special ed attorney, but I would think that like, you still have to, stick to all of these legislations and the rules behind them in terms of, now I haven't really heard how they're going to do ARD meetings and that kind of thing. But yes, I would think that you still have the accommodations.
Sure. Now this was before, not
so
now.
Nancy said no. This was before. Yeah.
Go ahead, Denise.
Sorry.
No,
I just noticed
you're not in trouble.
This was before, not now. Yes, Nancy. People are accommodating. In my experience,
absolutely.
With OCD are on 504 plans. At least in the districts that I've worked with, it's really hard to get an IEP for OCD, but it happens. But I think it's mostly 504, and that's okay. But a lot of the kids that I'm getting 504 plans are for perfectionists who have really great grades and straight A's. And I have to go into the school and help them understand that like it's at their own peril that they're getting these grades. They're not sleeping, they're melting down. They are like close to not wanting to go to school anymore. And so you have to kind of go make the case for why a student with very good grades should be getting accommodations. But yeah, most of the kids that I work with, if they and their families want to pursue a 504 or an IEP, are getting accommodations. I don't know, Aureen and Kathleen, what your experience is.
And Scott wrote, you need.
Like I said, legally, it's all there. And so, and I can't imagine that, like, now, I mean, it may be somewhat of a challenge, right? In terms of just, well, we haven't really gotten to that, or, you know, we have this big backlog or whatever, but still legally, you know, they have a certain number of, you know, days to respond and all that.
I think it's kind of well known that kids with anxiety and OCD often fall through the cracks at school because they tend to be more internalizing. They suffer more of a personal anguish that isn't apparent at school. And often kids with anxiety are the teacher's pet. You know, the perfectionists are the teacher's pet. The generalized anxiety kids are eager to please, conscientious, diligent, hardworking. The teacher doesn't know how much personal sacrifice and anguish there is there. But schools, I think, are often focused on the externalizing kids, the kids with the ADHD, the oppositional problems, the defined behavior problems, and they take up all the airtime. So these kids, the quieter kids, the well-behaved kids who may still really be struggling, fall through the cracks. So that is a well-known thing. And that may reflect Nancy's comment that they're saying he's not failing. So what's the need for the 504?
You know, you can definitely run into that. But thankfully, we've come a long way in terms of, you know, their ability. I think that, you know, the understanding of what that legislation was. I mean, again, not saying there are any challenges. I think to Denise's point, the big thing that I run into, like you said, they're not failing, they're making great grades. What is the problem, right? But the legislation, that's not how it reads. It reads the impact on learning. And the OCD has a significant impact on learning. So does the anxiety. Right?
Nancy, I don't know where you live, which state, which area, but often if you can get a healthcare professional to document your child's OCD or anxiety, be it your pediatrician, a therapist, and you take that to the school, that documentation will make it more legitimate in case it appears that your child is doing well. He's like a duck who's paddling really hard under the water, but looks like he's gliding on the surface. That can help. So I would, involve a healthcare professional if you wanted your school to help out with the accommodations.
And Scott even suggested you need an educational advocate to assist you. So I guess that can be that. I mean, it's also important too. I mean, we're talking about to educate counselors at school as well. I mean, the counselors are just as responsible. Their roles, are not necessarily. I know I've gone to a few schools and spoken about OCD, and the counselors really are just focused on, like what Aureen said. Those kind of oppositional behavior, things like that, are just grouping in. It's anxiety or it's depression. It's anxiety, depression.
But you would be surprised, like in some of the school districts I work in, the sort of high intense, wealthy communities, it's hard to convince some counselors to get on board with the 504 plan.
That's what I was saying.
Yeah. I'm just always so shocked that this day and age, it's still like, no, really, it's not. They're not lazy. Like they're not disengaged. They're not looking for a shortcut. In fact, most anxious kids don't want to ask for a shortcut. They feel like they're cheating. These are not the kids who are going to take advantage of any kind of accommodations. It's actually like you've had to twist their arm to actually get them to even consider accommodations. And so it's just so interesting that I'm just always so shocked when I bump up against that. Some schools are very open to it, and other schools are like, what, So I don't know.
And it's worth announcing that very soon on Anxiety in the Classroom, there's going to be a ton of content for parents. It'll be there for the next 2 weeks. It'll be there in the next 2 weeks, and have a ton of resources specifically around school advocacy. So keep an eye out for that. We'll be posting on social media and all the IOCDF channels.
Can I add a quick point about these accommodations and 504s? Is that, sometimes there is a perception that people are overusing accommodations or misusing them, or using them as an escape and not really tackling their challenges. So when I work with families, I say it needs to be a 2-step process. that accommodations are important to help you bridge the gap right now, but accommodations should ideally not be an end in themselves. That is not the end point. Ideally, they will just help you get there, but you need to work on the challenges. So I think perhaps sometimes school professionals have encountered situations where the family is asking for accommodations as sort of like a permanent endpoint, like my child should never have to do this or this or this. And so I think sometimes perhaps they're reacting to those kinds of experiences from the other side, to keep in mind.
Yeah,
but it can't be lost though that like, especially like in college, the fact that like we made so many strides can be just absolutely all the difference in terms of, for a child in terms of their success in some of these accommodations, especially when it comes to anxiety and OCD. Right.
Thank you. Go ahead, Denise. You had some thoughts.
I was just going to say that accommodations are not treatment, right? So treatment's treatment. Accommodations are designed to help kids get to the starting line, because when someone has debilitating OCD, anxiety, ADHD, whatever, depression, it's really like trying to do school with your hands tied behind your back. So it's just allowing the student to get to the point where they can access the curriculum and they can do the work, but it's not treatment. And yes, as Aureen said, the idea would be is if your student was in treatment, we would phase out the accommodations over time.
Right. And while I'm for accommodations, I really, as a CBT therapist, the real important thing is to learn to face those fears. So you have to be able to get there. I mean, I've had kids who've gone to college who've had so many accommodations, and then they get the accommodations in college. But guess what? They're not really cut out to deal with all the other pressures of college. So the accommodations can do a disservice if you use them as a crutch or, as a way to just cope every day. And then, they sometimes will have to drop out of college because they can't deal with all the other stuff. And it's going to catch up with you at some point. You can't just ride on the accommodations all the way through.
And that's what Amy said. Amy commented, we need to be careful that accommodations aren't accommodating anxiety. And hi, Joanne, I hope you're doing well. Thank you so much. Malia asks, and this, we're talking about this now, but maybe we can give her a few specific action items. Malia at 8:20 p.m. asks, what kinds of suggestions would you have for a teacher if not accommodating his high anxiety and OCD? So I think if a teacher's not, I would imagine so. That's what it sounds like.
Well, I mean, the starting place is, Denise, and you said that too, Aureen, is to go to the, counselor. The school counselor usually is the entry point at these determinations for these accommodations. Again, if the teacher is able to make these in, their own, within their own teaching, oftentimes they're going to be able to make some of these changes if they're just sort of minor, but if they involve something that's a lot more, major, and then there is an actual process to go through. And as you said, Aureen, then you have to have a letter, showing that this is, that you can meet criteria for the different situations. But again, thankfully, OCD and anxiety have been recognized for quite some time as the kinds of, things that we have the accommodations for.
Right. And I think if you're a parent, I would encourage you to, talk to your child and let your child know that you're going to support them in getting accommodations, but that again, the accommodations are a stepping stone to eventually learning how to handle all the challenges. It's like recovery or healing from anything else, right? Let's say you fell and you broke your foot, right? So for some time, you're not going to be able to walk and you're going to need accommodations. You're going to need crutches or a wheelchair or whatever. But eventually you don't want to be in those crutches or wheelchairs forever. You want to heal, you want to recover, and slowly you'll learn to do that. So think of accommodations as a stepping stone to recovery and while actively engaging in treatment.
And I think that's why it's good to get consultation from a therapist, because it's all about pacing. And so you can be very well-intended school personnel or parents and get these accommodations, but they could be used inappropriately. So if you have your child in therapy, like we're all saying, it's this dual process that are happening at the same time, then the therapist can help determine when it's time to step down, when it's time to let it go. Because like Aureen said, I can't tell you how many kids get into college, but can't stay in college because they don't have the skill set to deal with hard things. And home by Thanksgiving, and those are when they get the phone calls. So we don't do a service to our kids by, creating a world for them in which they don't have to do hard things. We want to create a kid in which they can heal the world. But sometimes kids are so overwhelmed with OCD anxiety, they just need the break to, like Amy said, level the playing field so that they can learn. But that's the first step. And then there's a lot that happens behind the scenes.
I think one of the accommodations, obviously, that comes up the most is additional time, right? Especially on the exam. And again, what we can do in our office is work on that time so that if the school is giving them 2 times, right? And then we work down to time and a half with a goal of speeding up our ability to meet that criteria, right?
Because extra time can be the worst thing for somebody with some forms of OCD, with perfectionism or rewriting, erasing. Extra time temporarily is a stepping stone. But again, in the long run, it's not teaching them how to handle that. So the exposure treatment for the rewriting and erasing is really what's important.
Absolutely. I want to, and Manor wrote, totally agree. This is for us folks who struggle with OCD of all ages across the board. I'm an OCD client, a college student, and a substitute teacher. Accommodations were set short-term only. Then I learned to do stuff without my learning accommodations. Thank God.
Excellent.
I acclimated to real world. So,
excellent.
Yeah. I kind of sit here just reminiscing on my own school experience. I don't think people talked about accommodations in the 80s that much. And it was, I was like, how did I even get through any of that? I got in so much trouble every day because I couldn't sit still. I couldn't sit at my desk. I wouldn't focus. They were constantly calling my parents. It's amazing that I even made it through school. We're winding up and winding up words. I hope I don't lose my job tonight. We are, I still don't know what I'm trying to say. Time is coming up. Time is near. It's ending the time. We have 3 minutes left, something along those lines. So let me quickly jump to final thoughts. This has been great though, and we're definitely going to do a volume 2 and continue this conversation. Also, if you guys have suggestions, please don't hesitate to email. I'll give you an email at the end. But Dr. Wagner, final thoughts.
Moderators, please post the needs assessment again. And
yes, it was posted.
Any of you didn't catch it earlier, here's the link again. Please participate so that we can, figure out what everybody needs and can help better. And hang in there. We're all in this together. It's a world of uncertainty, but it actually makes us stronger to have to deal with challenges. So dealing with challenges, gives us more grit.
Thank you, Aureen. Kathleen.
Distress tolerance is directly tied to happiness, right? And the more distress tolerance we have in the things that we face in our everyday life, that is what in the end is going to determine the amount of happiness that we have in our life. This is obviously very distressing. We don't love it, but the fact that we're acquiring new skills is developing ourselves in ways that we didn't even know that we could do. So it's really in having those victories over the things that we're developing, I think, right?
Wonderful. Thank you. Denise, final thoughts.
Just want to thank everybody for coming tonight. I mean, we really appreciate your input, feedback, and your questions. I mean, Scott, Amy, and Katie, thank you for co-facilitating this. You guys had amazing feedback and comments, so people should look through that. But, this is a time in which we feel like there's just so much that's out of our control. But again, a reminder that there are a lot of things that we do have influence over. And if we can practice influencing the things that we have influence over, we can improve our situations. And so just a quick reminder, some of those things are asking for help, getting into therapy, sticking to routines, which are super important, learning and practicing mindfulness, practicing good self-care, and using best practices around keeping ourselves and other people safe. And so thank you guys for coming, and I look forward to seeing you next time.
And thank you to our wonderful moderator and everyone at the IOCDF behind the scenes who makes this happen.
Thank you, guys. So as always, Aureen just stole all my lines. So It's fine though. It's fine. No, as always, I want to thank Aureen, Kathleen, and Denise for joining us. Although I want to say Deneen, so it's Aureen, Kathleen, and Deneen. I just think that has a nice ring to it. But regardless, I want to thank them for coming and sharing their knowledge and insight. It was brilliant and effective and wonderful and much needed. And we look forward to multiple volumes of this, continuing this conversation. Also, as always, I like to thank the International OCD Foundation, as well as my partner behind the scenes, Fran, for his digital voodoo. We have lots of programming coming up. We are in the midst of programming an Autism Spectrum Disorder Volume 2. We are in the process of planning a 50 plus and over with OCD Volume 2. Lots of Volume 2s on the way. Also, second week in October is OCD Awareness Week, as well as the virtual walk is coming up. IOCDF is hard at work creating as much virtual content, much like the conference, as possible. So stay tuned for all the updates in regards to those things. Also, Fran, if you want to put the virtual walk, the link to the virtual walk information so people can know where to go. As always, you can also check, Fran just posted the link to the IOCDF calendar for all events and live streams upcoming. If you haven't already and you want to be notified about all programming the IOCDF is having over the next month, definitely be sure to subscribe and follow on Facebook and YouTube. And also, we are new on Twitch as well, so you can follow us there as well. Also, if you have any comments, questions, concerns, suggestions, topics, things you want to address in the Back to School Volume 2, do not hesitate to email the IOCDF at info@iocdf.org. We will always get back to you, and so feel free to reach us there. So until next time, thank you for spending your Wednesday night with us. As always, you can contact the foundation, as I just said. Have a wonderful evening. Stay safe, stay vigilant, feel the feels. Don't let OCD off the hook, and we'll see you very soon. Have a good night.